Hello, and you're watching TV9 News and I'm your host Deepak. It was just recently that we showed you about the rise in COVID-19 cases among kids. The numbers are high and the situation is set to turn grim during the monsoon if proper precautions aren't taken care of. Now, the second wave has definitely dealt a heavy blow at India's healthcare sector. However, we aren't losing hope and this too shall pass. But with the arrival of monsoon over the horizon, influenza-like diseases and infections are likely to rise. Monsoons provide the perfect breeding grounds for such diseases. And after witnessing the surge in cases of children getting infected by the pathogen, Maharashtra's COVID task force and the newly constituted paediatric task force have jointly suggested immunizing children with influenza vaccine ahead of monsoon. On Sunday, the doctors from both the groups advised Chief Minister Uddhav Thackeray that administering the influenza vaccine would curb the viral infection and reduce load on hospitals and prevent unnecessary testing. So, what did the task force recommend? Number one, it said that 90 to 95% kids who are asymptomatic or with mild symptoms can be managed at home. 2. It said that 5% may get moderate symptoms and 1 to 2% may get severe COVID-19 symptoms. The task force said that the state needs more pediatric ICU beds for severe cases. It also recommended trained doctors to identify red flags in children. While these remain important, the most pertinent one of them all is getting the influenza vaccine. Let's speak to Dr. Srinath Manikanti, who is the senior consultant and a neonatologist and HOD at Fortis La Femme Hospital, and find out more. Now, Doctor, will taking flu shots ahead of monsoon save kids?
In the second wave of COVID, we are seeing increasing number of children getting affected with COVID. Also, the experts predict in the third wave, more children are likely to be affected as a result of mutating virus. So to decrease the burden on the healthcare system and the doctors who are dealing with the COVID, it is recommended that all the children less than 5 years of age are vaccinated against influenza. So what is influenza? Influenza is also called as flu. We commonly see increased number of influenza cases in children during monsoon season. Hence, if we offer influenza vaccine, the latest quadrivalent influenza vaccine, which is available, if we are offering it to these children less than 5 years, it decreases the burden and decreases the case of influenza. As a result, the healthcare system will not get overburdened with additional influenza to deal with additional influenza cases. Influenza cases or symptoms are almost similar to the COVID patients, and it can cause unnecessary investigations and unnecessary hospital stay. That can all be avoided by giving influenza vaccine to these vulnerable group of children.
What happens after a flu shot is taken? What kind of reaction follows? Is it similar to how COVID-19 vaccines work?
So influenza vaccines do not prevent the child from getting COVID because it covers only influenza and parainfluenza viruses. However, it decreases the burden on the healthcare system. COVID vaccines currently are not approved for use less than 18 years of age. A lot of trials are still being conducted between the age group of 2 and 18 years for the COVID vaccines, and it will take few months for the COVID vaccines to get approved for this age group. Until that is available, we have to vaccinate children against the common communicable diseases to reduce the burden on the healthcare system. So generally, influenza vaccines are very safe. We have been administering these vaccines every year to children for many years. Most of the children tolerate these flu shots very well. Majority of them do not have any adverse reactions. Some of them may have mild reactions like swelling at the site of injection or pain or fever, which can be overcome by taking simple paracetamol.
Now, what kind of protection does the influenza shots offer?
A latest quadrivalent influenza vaccine offers protection to children against influenza and parainfluenza viruses and prevents influenza-like illnesses caused by these viruses.
Along with the influenza shot, there are few other important things that you need to keep in mind. The symptoms that you need to watch out for. Number 1, if the fever persists for more than 3 days. Number 2, if the oxygen saturation level is less than 94%. Number 3, if the child is passing very less urine for the past 6 hours or hasn't passed it at all. Number 4, watch out for rashes and convulsions as well. And if all these symptoms are witnessed, then the child must be isolated for 14 days. So keep your children safe from the virus by keeping these points in check, and do let us know what you feel about getting your child a dose of influenza vaccine in the comment section below. And also do not forget to like, share and subscribe to TV9 News on various social media platforms. Many thanks for watching and stay safe.